Hospitalizations in this country hitting a record high nationwide. This comes as Dr. Anthony Fauci, CDC Director Rochelle Walensky, and other health officials testified in a Senate hearing today on the government's response to the Omicron variant. It was a contentious hearing. For more on this whole subject, let's bring in our ABC News medical contributor and board-certified physician, Dr. Darien Sutton, emergency physician, I should say. Thanks for being here, Dr. Sutton.
Thank you so much. So happy to be back.
We're glad to have you back. So during today's hearing, the CDC said it's also considering updating mask guidance to recommend that people use either the N95 masks or the KN95 masks instead of cloth ones. Can you explain the mask issue and if this is a good idea?
Yeah, so the basic goal of this is to protect people as best we know how, which obviously are the highest quality masks. The recommendation is that if you have access, using the N95 mask is the gold standard. That can help protect you substantially against exposure of the COVID-19 virus and its variants. And if you don't have access to that, the next best thing is the KN95 mask. And for those who don't have access to those two types of masks, the recommendation is probably to double mask. And by that, I mean using a surgical mask covered with a cloth mask. Cloth masks are made out of woven fabric, and in the setting of this highly transmissible variant, they still pose a risk that you might be exposed. So it's really important that if you have availability and access, to use that surgical mask as that first layer of protection to provide the highest level of protection you can get.
Got it. And the CDC now saying, if you can, go for those KN95, N95 masks. And according to the CDC today, as of today, the Omicron variant's now estimated to account for 98.3% of new cases in the U.S. It's taken over. Does this mean that Delta is gone? What does that tell you, that figure?
Well, it doesn't necessarily mean that Delta is gone, but the majority of cases are likely secondary to the Omicron variant. The next question that people often ask is, with the high amount of transmission that we're seeing, will this mean benefit in terms of overall community immunity? But we don't yet have evidence or data to substantiate whether or not an infection secondary to the Omicron variant confers protection against future infections. That's data that we still don't yet have. But what we do know is that vaccines are still proving incredibly effective. New data coming out of Washington State shows that those who are unvaccinated are 2 to 3 times more likely to get infected and more than 10 times more likely to get hospitalized. So it's really important, if you haven't done so already, to go out there and get that vaccine, and if you're eligible, to grab that booster.
All right, so switching subjects here. In New York, the case numbers are so high there that the state of New York is no longer requiring local health departments to do any contact tracing because the sheer number of cases makes it basically impossible. It comes as a surprise. When I had COVID in October, a breakthrough infection here, I never heard from the district. I did hear from our company. Disney owns ABC News, so there was contact tracing here. But how crucial is contact tracing from the state perspective in this pandemic at this point?
I think contact tracing in all senses is incredibly important when you think about the mitigation efforts of vaccinations, ventilations, and making sure that you keep a distance as best you can. Although this is probably a sign, honestly, of the dwindling resources that have been utilized to take care of people who are suffering from the COVID-19 surges that we're seeing in New York City and here in Los Angeles. But it doesn't stop the recommendation that if you test positive, to let those who you've been around within the last 5 to 10 days know of your status. And also, it does not stop to encourage, you still should encourage companies and small businesses to participate in contact tracing in some effort or way to help people know their status so that they can act accordingly.
So we can take responsibility ourselves for keeping other people safe if we get infected. That makes good sense. As always, Dr. Sutton, thanks very much.
Of course. Thank you. Have a good day.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.